Hi everyone. Today we'll talk about a recently published large meta-analysis that has shown how even small increases in non-occupational physical activity can have significant health benefits. The study is the largest dose-response meta-analysis ever conducted, covering 94 cohorts and over 30 million participants. It found that higher activity levels were linked to lower risks of all-cause mortality, as well as incidences of cardiovascular disease and cancer. Meta-analysis estimated dose-response associations for 9 specific cancers for the first time, with the evidence base larger than any previous meta-analysis for 17 of the 22 health outcomes they examined. Scientists discovered that the chances of experiencing fatal outcomes related to cardiovascular disease and cancer are lower with more physical activity. Even small increases in non-work-related physical activity showed the most significant health benefits, particularly for people who are typically inactive. Although the benefits of exercise continue to increase with more activity, from a certain level the additional benefits become less significant. The study observed that the advantages of physical activity begin to decrease after exceeding approximately 300 minutes of exercise per week, and the evidence supporting benefits becomes weaker beyond this point. The study also showed that shifting population levels of activity towards achieving 150 minutes per week of moderate to high-intensity aerobic exercise could potentially prevent 16% of all premature deaths. This means we could potentially save up to 4 million lives every year by adding just 21 minutes of brisk walking a day. The researchers found that engaging in moderate to high-intensity aerobic exercise can lower the risk of death from all causes, which is consistent with previous studies. However, this level of exercise has an even greater impact on reducing the risk of death from heart disease. It is worth mentioning that according to the collected data, engaging in moderate-intensity aerobic exercise for just 75 minutes a week can also significantly reduce the risk of mortality, cardiovascular disease, and cancer. However, it's important to note that study only considered physical activity done outside of work. This means that any benefits from being physically active while working might not have been included in the study. Additionally, the authors acknowledged that there could be mistakes in identifying certain diseases and determining the cause of death, which might affect the results of the study. This meta-analysis demonstrates how doing a little bit more physical activity outside of work can help you stay healthier. It shows that if everyone engaged in at least half of the recommended levels of physical activity, 1 in 10 premature deaths could potentially be prevented. That's all for today's episode. Don't forget to like and subscribe, and we'll see you next time.